Hey, Casey.
Hey.
How you doing?
Good. My name's Casey. I'm going to be your nurse today. Can you just confirm your name and date of birth for me?
Charles 501-2360.
Alright. I'm going to wash my hands, provide privacy. Alright. Your doctor's ordered you to have a complete physical assessment today, so that's what I'm going to be doing, alright?
Okay.
Alright. So we're going to first just do our general inspection. See if your patient's making eye contact with you, seeing if they're alert and oriented, and their skin. Alright, so is it okay if I touch you?
Yes.
Okay. Alright, can I take your hat off?
For a minute.
Okay. Alright. So we're going to assess this hair. Alright. So, look at that. Look at your head. It's round and symmetrical. Are you having any headaches?
No.
Okay. What about any ear pain or drainage?
No.
Alright. And your nose is symmetrical. Can you hold one nostril and breathe in and out? Okay. And then, can I look at your eyes? Alright. Are you having any vision loss?
Mm-mm.
Okay. Having any nosebleeds or anything like that?
Nope.
Alright, and can I look at your mouth? Alright, any trouble swallowing?
No.
Alright, and then I'm just going to look at your trachea. Alright, it's midline. Are you having any sore throat or anything?
Just from the stitches.
Okay. Alright, put that back on. Now I'm going to do a cardiac assessment on you. Okay, can you turn to the side for me? I'm just checking for JVD, and then I'll go to the other side and check. Alright, and now I'm going to check your capillary refill. Also looking at the skin and the nails. Alright, good. Now I'm going to check for edema on both sides, on your upper and lower extremities. Alright. No edema. Okay. Now I'm just going to listen to your heart. Are you having any chest pain?
No.
Okay, good. Alright, so we're going to go to the aortic. And pulmonic. The Erb's point. Tricuspid. And mitral. Okay, good. Alright, now I'm going to do a respiratory assessment on you, okay? Are you having any shortness of breath? Anything like that? Okay.
Nothing I do.
Okay. Alright, I'm just going to listen to your lungs if that's alright. Are you having any cough or mucus production?
No.
Okay.
Nothing I do on.
Okay. Alright. Breathe in and out. Take a deep breath. Okay. Deep breath. Deep breath. Deep breath. Okay. Deep breath. Alright, just lean up for me and we'll listen to your back. Alright, deep breath. Deep breath. Okay. One more time. Alright, good. So if you were having any mucus production, you would use an incentive spirometer, and that's just to help prevent pneumonia and get that mucus up.
Right.
You would use it 10 times per hour.
Mm.
And you can do it while you're watching commercials or something like that. And then also the turn, cough, and deep breathe method, that's going to help get that mucus up as well, okay?
Okay, thank you.
Alright. Now we're going to do your, the neurological assessment. I assessed your ears, your nose, eyes, mouth, and all that stuff. Can you tell me your name again?
Charles 501.
Okay. And what year is it?
22.
Okay. And who's the president?
But
And let's see. And what are you doing right now? Where are we?
at my house.
Okay, good. All right. So you're alert and oriented times 4. Let's see. And I looked at your skin. Did our general inspection and did the heart and the lungs. Let's see. Now we gotta do your musculoskeletal assessment. Are you having any like stiffness and joint pain, anything like that? Okay. All right. So I'm gonna get your arm. All right. So this is extension, and then can you just flex your hand down? Is that down? Flexion, and then hyperextension. You're gonna hyperextend back. Good. And now we're gonna do the same thing with your elbow. So you can flex it, and then can you put it behind your back? That's hyperextension. Good. All right. And now I'm gonna do the other side. Same thing. So hyperextension, flexion, and then regular extension. And then we're gonna you can do your elbow, so flexion, and then hyperextend. Good. Now I'm gonna check your strength. Alright, so push up against me. Okay. And then push down. Alright, good. And now I'm gonna do your knees. Just do regular for me. Okay. Have a little bit of crepitus. No, just kick out. Have a little crepitus in your knees. Alright, so this is extension, and then flexion will be back, and then hyperextend. Hyperextend. There you go. Alright, good. Let me do your ankles. Here, we can do your strength real quick. Alright, push up against me, and push down. Good. Alright, so same thing, extension, and then flex, or is that, yep. Okay, same thing, flexion, hyperextend, good. Alright. You have full range mobility. Now we're going to do a gait test and the Romberg test. Can you stand up for me? Sorry. Alright, you can face towards me. Alright, so this is just going to test your balance. You can close your eyes. Alright, good. And if you'll just take 10 steps heel to toe, you can do that way and then back. Good job. You can sit back down. Alright, now we're going to go over your pain assessment. Are you having any pain today?
In my back.
In your back? Okay, good. Can you...
Is that about a 5?
A 5? On a scale of 0 to 10? A 5? Okay. And what kind of pain is it?
Nerve pain.
Nerve pain? Okay. And does anything make it better or worse?
Gabapentin.
Gabapentin? Okay. And what dose of gabapentin are you taking? Do you know?
Hmm?
What dose? Do you
I
know?
take 2 in the morning, 3 at night.
Okay.
400 milligrams.
400 milligrams? Okay. Alright, good. And do you think this pain affects your daily life?
It does.
Okay. Alright. Let me make sure I didn't forget anything here.
Hey, man, movie star. When y'all get y'all certificate, I want mine too.
Alright, and then I forgot on your neurological assessment to tell you about the Glasgow Coma Scale. If you have happen to have a brain injury, we would use that to assess your vision, motor, and let's see.
So we gotta go through all this again?
No. Vision, motor, and eye responses.
Okay.
So we don't need to do that. And let's see. Are you having any like dizziness or anything?
No.
Okay. Oh, I gotta do your sound sounds and all that. Okay. So now I'm gonna do an abdominal assessment. If that's
What's that?
alright. I'm just gonna listen to your abdominal sounds.
Alright.
If that's okay. Do you have any pain, urination pain, or any trouble with your bowel movement? Alright, good. Alright, we're gonna start in the lower right quadrant, which would be right here. And we would normally listen to these for a 1 full minute, so we're not going to do that. In your upper right quadrant. Upper left. And lower left. So normal vowel sounds, and then we're going to listen in between the xiphoid process and the belly button. So about right here. And we would listen right here for 1 minute. Oh, I'm sorry. We turn the bell over and listen for a minute. Okay. So no abnormal sounds there. I think that's it, Mr. Charles.
Alright.
Alright, thank you.
Send me my certificate.
Okay.